Hello, my name's Michelle Falconer, and I'm one of the immunisation nurse specialists at Public Health England. I've been asked to talk to you today about the dried blood spot testing service that's offered by Public Health England. So this presentation is relevant to those women who've been diagnosed with hepatitis B and who are pregnant, and also to those women who are diagnosed with hepatitis B and who've recently delivered their baby. This presentation will last around 20 minutes, and during it we'll take a very brief look at the hepatitis B virus and infection of the liver. We'll look at transmission of the virus, in particular vertical transmission, and we'll look at the immunisation schedule that's recommended for infants born to women with hepatitis B. We will then focus more specifically on the dried blood spot test, which is the test that's recommended for these infants when they become 12 months old. The World Health Organization has estimated that there are around 250 million people worldwide who are chronically infected with the hepatitis B virus. Hepatitis B is a blood-borne virus that's present in body fluids and infects the liver. Once infected, the virus replicates, and the healthy liver becomes inflamed and develops scar tissue. This then can lead to fibrosis and chronic hepatitis. As the scar tissue replaces the normal healthy tissues, cirrhosis can develop and can further progress to liver cancer and death. Transmission of the hepatitis B virus occurs through parenteral exposure to infected blood or body fluids. This can occur in one of several ways. It can be sexually transmitted during sex without a condom. It can occur as a result of percutaneous exposure. This could be something such as using unsterilised equipment when having a piercing or a tattoo. It could be during medical or dental treatment, or it could be from sharing needles. It can also occur through perinatal transmission from mother to baby during pregnancy or birth. Transfusion-associated transmission is rare in the UK. As blood donors and donations are screened, transmission from bites of infected persons is also rare. Further information on hepatitis B can be found in the online version of the Green Book on the gov.uk website. Globally, vertical transmission is the most common route of acquisition of the hepatitis B virus. These newborn infants have a higher risk of transmission as they've been exposed to blood and other body fluids in utero and during birth. If infected at birth or in the first year of life, around 90% of these infants will develop chronic infection, and between 15 and 40% will progress to cirrhosis and liver cancer. Early recognition of these infants through testing is essential, as over 90% of those who develop chronic hepatitis B infection will not have any symptoms, so their infection will go undetected until tested. Hepatitis B infection is usually described as being either chronic or acute. Although the incubation period ranges from 40 to 160 days, the average is around 60 to 90 days. Symptoms usually start with anorexia and nausea and an ache in the upper right abdomen, but can also include flu-like illness, weight loss, arthralgia, vomiting and jaundice. Not all patients develop symptoms though, and in those patients who don't develop symptoms, the infection will only be detected by abnormal liver function tests or the presence of serological markers of infection. Many individuals are able to clear the hepatitis B virus from the body and recover from infection without treatment, but it's important to remember that infants with hepatitis B infection do not usually display any signs or symptoms, so it's vital that they are tested at the time of their first birthday. Chronic hepatitis B infection is also known as persistent infection, as it means that the hepatitis B surface antigen, which is one of the serological markers of infection, is still present in the serum 6 months after exposure. The risk of developing chronic persistent infection depends upon the age at which the infection was acquired. If infected in adulthood, around 5% of cases develop chronic hepatitis. Between 20 and 50% of those infected as children, for example, those who are aged between 1 and 5 years old when infected, go on to develop chronic infection, where around 90% of those infected in infancy develop chronic infection. Specialist treatment is required for these people with chronic infection as they've got a high risk of death from cirrhosis and liver cancer in later life. They will also require specialist treatment and care. This includes infants born to hepatitis B infected mothers who are diagnosed when they're 1 year old. In England, all pregnant women are offered screening for hepatitis B during every pregnancy, and this is regardless of the previous results. Around 3,000 of them will test positive for Hep B each year, and around 300 of those will also have high levels of infectivity. Hepatitis B infection in pregnancy can result in severe disease for the mother, as well as chronic infection for a newborn infant. Women who screen positive may require antiviral treatment, and they will be cared for by the maternity provider screening team and a clinical multidisciplinary team. All women will also be informed of the importance of protecting their newborn baby from the hepatitis B virus by vaccinating them. Hepatitis B infection is diagnosed by detecting specific serological markers. These are known as antigens and antibodies. Antigens are protein components of the virus. When a person's immune system detects unknown antigens produced by pathogens such as hepatitis B virus, it produces antibodies which bind to the antigens and help to fight the infection. Some of the key serological markers used to diagnose hepatitis B infection include hepatitis B surface antigen, which is a protein on the surface of the virus. It can be detected in high levels in serum during acute or chronic hepatitis B infection. The presence of this antigen indicates that the person is infectious. The body normally produces antibodies to this antigen as part of the normal immune response to infection. Hepatitis B surface antigen is also the antigen that's used to make the hepatitis B vaccine. Hepatitis B surface antibody is generally interpreted as indicating recovery and immunity from the virus. Hepatitis B surface antibody also develops in a person who's been successfully vaccinated against hepatitis B. Total hepatitis B core antibody appears at the onset of symptoms in acute hepatitis B and persists for life. The presence of this antibody indicates previous or ongoing infection in an undefined time frame. IgM antibody to hepatitis B core antigen indicates recent infectious with the hepatitis B virus, usually within the previous 6 months. So its presence indicates acute infection. Earlier, I mentioned that some mothers may have higher infectivity. Maternal infectivity depends upon the phase of chronic infection, and it will be indicated by her viral load and by the presence of hepatitis B-E antigen and hepatitis B-E antibody. Infants born to higher infectivity mothers have a 70 to 90% risk of developing hepatitis B infection, whereas infants born to lower infectivity mothers have a 10 to 40% risk of developing infection. We mentioned earlier in this slide set how important it is that infants born to hepatitis B infected mothers are tested for infection when they reach their first birthday. However, only 50% of these infants are reported as being tested, despite their high risk. I also mentioned earlier that all women will be informed of the importance of protecting their newborn baby from the hepatitis B virus by vaccinating them and ensuring that they are tested for infection at the time of their first birthday. This is a specific vaccination program for these infants as they've already been exposed to the hepatitis B virus during the birth process. The vaccination program for these infants starts at birth, and if the course is completed as recommended, it will be over 95% protective against vertical transmission of the virus to the infant. As infants born to higher infectivity mothers also have a higher risk of developing infection, they'll require hepatitis B immunoglobulin at the time of birth to provide them with immediate protection from the virus. This slide shows the current immunization schedule. Although the routine immunization schedule now includes protection against hepatitis B for all infants, it does differ for those infants born to mothers with hepatitis B infection, as they require additional doses of hepatitis B vaccine. The routine program includes the administration of a 6-in-1 vaccine, a hexavalent vaccine, to protect against diphtheria, tetanus, polio, pertussis, Hib, and hepatitis B. And this vaccine is administered at the ages of 8, 12, and 16 weeks. Infants at risk, or those born to mothers with hepatitis B, should receive their first dose of monovalent vaccine at birth, and this will be followed by a second dose at 4 weeks of age. They will then continue with their routine vaccination program and receive the hexavalent vaccine at 8, 12, and 16 weeks. They then should have a final dose of monovalent hepatitis B vaccine at 1 year of age, plus a blood test to check for infection. Taking a blood sample from young children can be challenging, and if they're referred to local phlebotomy services, delays can happen. Public Health England provide a free dry blood spot testing service for infants born to mothers with hepatitis B. The test is not intended to be used for infants whose mothers are not hepatitis B positive, even if another household member is. Those infants should be screened and vaccinated according to national guidelines, but not using the DBS kits from Colindale. I mentioned earlier that only around 50% of those infants at risk are tested for infection. PHE data has shown that this may be due to difficulties in obtaining venous blood samples from young infants and also from non-attendance at hospital phlebotomy services. Using the dry blood spot test can help to improve uptake of testing of these at-risk infants. It's simple, it's free, and it's very quick to do. It's performed at the same appointment as the routine vaccines are given at 1 year old. There are no visible needles because an age-appropriate lancet is used, and this can also help to reduce anxiety and stress for the parent, the healthcare worker, and the infant. The dry blood spot testing kit contains all of the equipment required to complete testing of the infant. Instructions are included, and these should be followed carefully to ensure sufficient blood is placed on the spots indicated. If the spots are not correctly filled, it may not be possible to report a result from them. The dry blood spot test kit contains a request form, the dry blood spot card, a clear bag, an alcohol wipe, an instruction sheet, a replied paid specimen bag, and an automated single-use safety lancet. It's important to remember that this lancet is designed for use in infants aged 6 to 24 months. If an individual of any other age requires testing, an age-appropriate lancet should be used. When completed, the dry blood spot test should be returned to PHE Colindale, and the results will then be sent to the requesting clinician, which is usually the infant's GP. They'll also be sent to the local coordinator and copied to PHE Health Protection. On the gov.uk website, there's a short video which demonstrates how to take a dry blood spot testing kit. No specific training is required to perform this test, as the process is similar to other blood tests where a lancet is used to obtain spots of blood. However, it is important to remember that the lancet should be used along the sides of the heel, and the sample should not be taken from the back of the heel. It's also essential that the spots on the card are filled as completely as possible. When the results of the dry blood spot test are ready, they'll be sent out to the requesting clinician with a commentary provided by the laboratory. As hepatitis B serological results can be complex to interpret, any queries should be made to PHE Colindale using the contact details provided in the report. If the dry blood spot test is positive, the infant will need to be referred to a paediatrician or to hepatology services, as a positive result means that the infant is infected. If the result is negative, no further action is required and the parents can be reassured. All household and sexual contacts of a confirmed case of hepatitis B are usually followed up through testing and immunisation and referred to specialist services as necessary. If phlebotomy services were used to test the infant rather than the DBS test, the results should be sent to PHE Colindale. It's really important to get the dry blood spot test right, because not doing so can mean that the test will need to be repeated, and this may delay any diagnosis in an infant who tests positive. So some key points to remember when performing the dry blood spot test are: check the expiry date on the card, put the card on a clean surface and complete all of the fields, and please ensure the infant's NHS number is documented. It's also essential to ensure that the lab request form is fully completed. When ready to test the infant, ensure they're securely held and the heel to be used should be exposed. If necessary, the heel can be cleaned with an alcohol wipe, or if it is, the area should be left to dry completely before using the lancet. When ready, firmly place the single-use safety lancet against the infant's heel along the side and not the back, and press the trigger. Let the blood flow naturally from the puncture site and fill a minimum of at least 3 circles on the dry blood spot testing card. The blood should not be layered, because inadequate samples will not be processed and they'll need to be repeated. Allow the blood spots to air dry on the card for at least 10 minutes, and this should be done away from direct heat and sunlight. If necessary, apply gentle pressure to the child's heel, and if required, a spot plaster can be applied. When the card is dry, fill the top over the blood spots and post the card and the lab request form to the laboratory. This should be done within 24 hours, and the reply paid specimen bag should be used. The parents can be informed the results will usually be available within around 2 weeks, and any interpretation and recommended further actions will be sent to the GP. Any outstanding doses of vaccine can then be administered, including the final monovalent dose of hepatitis B vaccine. So to summarise, for infants born to mums with hepatitis B, they require a dose of monovalent hepatitis B vaccine at birth. Immunoglobulin may also be required depending upon the mother's level of infectivity. At 4 weeks old, they should be offered a monovalent dose of hepatitis B vaccine. They then transfer to the routine schedule and receive the hexavalent vaccine plus other scheduled vaccines at 8, 12 and 16 weeks of age. And at 12 months old, these infants require testing for infection. Following that, they should receive all outstanding vaccines as scheduled. If your organisation or surgery is not signed up to the PHE Dry Blood Spot Testing Service, I would encourage you to discuss this within your organisation. It's very easy to sign up to it. There are dedicated pages available on the gov.uk website. And if you want to join the service, you can email the Hepatitis B at-risk infant surveillance team at PHE Colindale. Their email address is hepatitisbbabies@phe.gov.uk. This email address can also be used to send general enquiries, further support and requests for information. There are a number of useful resources also available on the dedicated Hepatitis B dry blood spot testing pages. These include information documents for healthcare workers, infographics, a link to the video that I referred to earlier, and information about the dry blood spot testing service. There's also information from an evaluation, and further information on hepatitis B can be obtained from the Green Book and the nhs.uk website. That concludes this presentation. So thank you for listening, and I hope the information has been useful.